So breast augmentation versus breast lift, which is right for you? Honestly, a very good starting point is to kind of ask yourself, are you happy in a bra without a lot of padding with the volume of breast tissue that you have? So when you put an unpadded bra on and your breasts are lifted in that bra, do you feel comfortable with yourself? Are you happy? Or do you feel like you're lacking some fullness? You'd like to be a little bit fuller. I think one key thing that's sometimes hard to figure out is that some women are pretty happy with the volume, but they want a little bit more fullness up top. Sometimes that can require an augmentation and a lift. But right now we're gonna focus on breast augmentation or breast lift. So if you really feel like you don't have enough volume, your breasts are too small, too flat, you don't fill out your bra, then a breast augmentation is going to be the best procedure for you. However, if you really do like the amount of volume that you have, it's just that your breast is sitting lower on your chest and it's hard to fit into bras and bathing suits and bralettes because the tissue is just down lower where it doesn't belong, then a breast lift is a great choice for you. In terms of the difference between the two operations, a breast augmentation is generally done through a 4 centimeter incision, very small incision, and the implant is placed. Typically, I place it in a dual plane as this leads to lower rate of capsular contracture. A breast lift, on the other hand, requires an anchor-shaped incision. So there's an incision to make your areola smaller, because typically when your breast has descended or is sitting lower, your areola is quite large. So there's an incision on the areola to make it smaller, and then there's an incision going straight down and then underneath on your breast. So in the end, you end up with an anchor-shaped incision on your breast. Why is it necessary to have that incision? Because typically when the breast is sitting low and you have a lot of extra skin, we really have to reduce that skin and lift everything up at the same time. And so that requires that style of incision. There are other techniques that are minimally invasive for a breast lift, but a lot of times they don't get you the result that you're looking for, or the scar spreads or stretches over time. So both operations are wonderful, and both operations can make you feel rejuvenated and make you feel better in clothing, but it's important to understand the difference between the two. We can talk more in a little bit about when is a breast augmentation and lift a good option.